Welcome to In a Heartbeat, coming to you from the War Memorial at the studios of WMTV Channel 5 in Grosse Pointe Farms. I'm Dr. David Balle, and I'm your host for In a Heartbeat. Today, we're going to talk about the St. John Providence Dog Therapy Program, and I have 5 very special guests today. And I'd like to introduce each of them to you. To my right, I have Cheryl Thrushman. And over here, sitting next to her, I have Kathy Flynn. And sitting next to her is Diann Baekelandt. And not to be left out, we have our pet therapy dogs, Paxton and Hope. So we welcome all of you and thank you for coming to our show. So I was very excited to be able to have you come on the show today because I've always been a dog lover. I have a dog myself, and there's something irresistible about a dog that we all sort of appreciate. So Cheryl, I'm going to start off with you. Can you tell us a little bit about your background, and then what is the St. John Dog Therapy Program?
Sure, and thank you for inviting us today. My personal background is that I got involved with animal therapy, dog therapy in particular. I had a lab who, at about age 2, a big yellow lab who was absolutely the Marley and me dog to a T. And at 2 years old, I took him into training, and I walked into this training class, Basic Obedience. And it was the first time I ever took a dog to class that I came out and we both learned something. Mm-hmm. So I thought, there's something going here. I stuck with the trainers, and eventually I was able to get my dog to pass the Therapy Dog International test. So my personal dog became a therapy dog, and my husband and I were volunteers at the Ann Arbor Veterans Hospital. So we found it very, very rewarding, as you can imagine. Mm-hmm. It was just really a great experience. So from there, we just felt that pet therapy was really a great thing to do.
How long has the St. John Providence Dog Therapy Program been in existence, and how did it come to be?
Sure. We started it in '08 when Providence Park Hospital in Novi opened. We had a new hospital and a new president, and we took the concept to her, and she immediately approved it. From there, we went to the foundation and engaged their services in helping us identify non-operating dollars. And at the same time, we were working with infection control to develop policies and procedures that would ensure the safety of our patients and our pets and our handlers. And at the same time, we were developing the program to be very structured and how we were going to do this because it was so new to us and the system.
And Cheryl, what is your role in the program?
I'm basically the champion for the program. So our dogs and our volunteer handlers all fall under the volunteer department at each hospital. And I work with the managers of that department and the handlers to make sure that we have a smooth running program.
How many dogs and volunteer handlers does the program have, and which hospitals in the St. John Providence system are they a part of?
Sure. Well, we have 10 dogs throughout the whole system, and we have 7 hospitals, including Brighton Center for Recovery. So our 10 dogs are Labrador Retrievers or Golden Retrievers. We find that they're just really suited for that type of role. They enjoy people, and they're very easily trained because they're so food motivated. And we have 20 hours of training into each of our handlers. We have about 60 plus handlers. So everybody is specifically trained as to how to handle the dog, and they have very specific commands, verbal and nonverbal. So when Kathy comes in to take out the dog, her shift, it's seamless for the dog because the dog understands her commands, and it's seamless for her because she knows the dog and the facility.
How long does it take to train the trainers and to train the dogs?
Well, our dogs actually come from, we've partnered up with Paradise Dog Training in Fenton, Michigan, and they are our dog trainers and providers. So they identify a dog, and at about 18 months old, based on the behavior, exemplary behavior, and the health of the dog, they will start to groom the dog for the role. So the dog needs to pass the AKC Canine Good Citizen test. They need to pass the Therapy Dog International test. And that takes time. As you can imagine, 18 months, that dog is still, I want to be a puppy, I don't want to be a puppy. So we work with them, and once they feel that the dog is ready, we bring them into the hospital, and now they're exposed to a whole different set of sounds and apparatuses and smells that they've never been around. If they can get through that and they're comfortable in the environment and we feel it's a good fit, then we'll bring the dog on. And the whole process at the hospital starts from there, which is another step.
So how does your training provider find these dogs, and how do you know it's the right fit for you?
Yeah, the providers, Paradise Dog Training, they have several types of dogs. They train for therapy dogs, they train for service dogs and assistance dogs, and they've been doing it for a very long time. So they have a real good idea of what's going to work. They will identify a dog and start working with the dog. They take them out to Lowe's, Home Depot, all of the places in the community where there's a lot of people. And if the dog responds well and doesn't shy away from people, then the next step is the training. And again, Labs and Goldens are so easy to train because they're so food motivated. All positive reinforcement training, and we start to look at that dog, and if the dog comes in and is happy to be at the hospital, doesn't shy away from a patient bed, doesn't shy away from certain areas of the hospital that may have different unique smells and sounds, then we think it's a pretty good fit.
So Cheryl, this may seem like an obvious question, but people may not know. What is the goal of the program? What are your end goals when a therapy dog is in the hospital or sees a patient?
Yeah, our entire goal is to enhance the patient experience. So we realize that not everyone likes dogs and not everyone wants to be around a pet, but statistics show that 70% of the U.S. households actually have a pet. So we thought that pet therapy, and all the studies show that pet therapy is a positive therapy for many people, not just patients, but for us at home. And we come home from a hard day at work and we get our pet therapy, right? You do. Mm-hmm. So we felt that it was a really good thing to bring along. And you know, there are many organizations in our communities that offer pet therapy to bring the dogs into the hospital. And while that's a great service, we like the concept of owning and managing our own program. So again, we own dogs that we know their behavior is exemplary. We know their health is top-notch. We know that they're up to shots and everything is very predictable and safe. So to be able to provide that safe pet therapy and reliable was really our goal to help enhance the patient experience.
Cheryl, are there any studies or statistics which show medicinal or therapeutic benefits when somebody who may be either well or ill is around a dog, the benefits that they get?
I can't quote any study. We've read a lot. As we were developing our program, we went and we looked at a lot of different opportunities online. You could read everything. And it does show that it does help. And I can't quote, but I can tell you that our handlers and myself as a handler, I have seen it firsthand. We've had stories about our handlers have taken the dog into the room and the family may say, you know, the handler always knocks on the door and says, "Would you like to meet Paxton?" And the family would say, "Sure, but Mom hasn't talked in 3 days. I don't think she'll even respond." And Paxton gets up to the bed, and all of a sudden, Mom is like, "Wow!" And she's petting the dog, and she's engaging. Yeah. And there's usually not a dry eye in the room. Mm-hmm. It becomes a very therapeutic for the family as well as for the patient. And there are a lot of our handlers have a lot of those stories. I'm sure you folks have experienced it that firsthand as I have.
And I think sometimes, I believe studies have shown that, you know, just touching a dog kind of lowers our blood pressure and calms us. And I feel that sometimes, a pet or a dog is a very non-threatening way to, help our sense of touch and communication. The dog isn't going to come in and, get some blood from your vein. You know, the dog is going to tell you something that we may not want to hear. They're just there for love and companionship and to share a human bond. Yeah. And that's part of therapy too.
Yeah, and I do think that, you know, when the dog comes into the room with the handler, the patient for that visit, they kind of forget where they're at. Mm-hmm. You know, they forget about the IV in their arm, they forget about the test coming up. All they want to do is pet the dog, and a lot of times they'll engage conversation with our handlers about their own pet at home or the pet they had as a child. And it just allows them to, as you indicate, just kind of forget about what the present is and think of something other than the hospital.
And takes them to another place.
Yeah.
Do you have any other, that was a great example that you shared, do you have any other examples of, you know, kind of happy successes or outcomes?
Yeah, we have a lot. You know, there's been so many visits, and we have good ones, and we have funny ones, and we have sad ones. And I'll stay away from the sad ones because they always get me very emotional, as probably you girls too. One of the funniest ones that I heard at our hospital in Novi, there was a patient there, an elderly woman, and she was confused. And her daughters were coming to visit on a regular basis, but they didn't come together. One came in the morning, one came in the afternoon. Well, the daughters did a really great job at communicating about mom's status. And one of the daughters said to her sister, you know, I saw mom today. And she kept telling me there was a big black dog. And she said, and the daughter was very legitimately upset. She says, I don't know what's going on, but her status, cognitive status is really changing. She thinks there's a black dog that comes to her bed at the hospital to visit. So the sisters are ready to talk to the physician about this, and they're very concerned, and they're there together, and here comes the therapy dog down the hall, and they're like, oh, thank God. Thank God there really is a dog.
Yeah,
so those kinds of things are fun.
I could see that happening.
So could I, yeah.
Yeah, that's great. I understand the program is run completely upon the goodwill of others and donations. How does this work? And tell us how somebody may get involved or what successes you've had with that.
Oh, sure. It is.
And you know, people may not realize that, you know, funds like this are just not part of a hospital budget. You know, hospitals today with that current healthcare climate, you know, there are declining reimbursements. We're having to do more with less. And so, you know, these extra special things that add wonderful healing touches, whether it's equipment or the therapy dog or a special room or being able to do a special procedure, wouldn't be possible without the generosity of others. Yet they enhance our healthcare system in a way that we can't, you know, put a dollar figure on. So how does something like this, which there isn't funding for, it's just not possible, how does this come about?
Yeah, how does it happen?
Yeah.
And it happens by the generosity of staff, physicians, volunteers, donors. We've been really blessed because our associates are so engaged, as are the physicians, and volunteers obviously are very engaged. So it really does take the whole makeup of the hospital to make this possible. Additionally, when we started the program, we went out to the community and we talked with grooming services and veterinarians and found some outstanding clinics, veterinary clinics and grooming services that have jumped on board with us. So about 90% of their veterinary care and grooming services are in-kind donations, which is, for any of you who own a dog, just a dog, you understand the medical, just to keep them healthy, the expenses that come. So we're really grateful for that, and we were really excited when we started the program. Pet Supplies Plus, who has their national headquarters in Livonia, they knew about the program and they came to us and immediately said, we want to engage with you folks.
That's wonderful.
Yeah, they have been extremely supportive from the get-go. So they provide all of the dog food, anything a dog could want. a bed, a million toys and treats and leads and everything that we need.
That's very generous and kind of them.
Yeah, it really is.
And so, how does St. John Providence partner, in addition to something like Pet Supplies Plus, with other organizations or individual donors to be a part of this? Do you have like an outreach, or do you call or solicit people, or do you just is it by word of mouth or sharing, or how does that happen?
Yeah, we do all of the above. So our dogs, we find that our dogs have about 120,000 encounters a year. So they are out there a lot, and they see a lot of people in all our hospitals. And their little vests here, we like to promote the people that help us. So the services that help us, I always say they're like little
yes.
NASCARs running around
right,
with
right.
logos on. But we really do go out and we seek the services and we ask people to help us. And it's all done through the foundation, St. John Providence Health Foundation, and they do a terrific job at keeping this program alive.
Which brings me to a question I wanted to ask you. Recently, St. John Providence received its largest ever single donation from an individual to the Therapy Dog program. And I understand there's a Grosse Pointe connection to this. Could you share with us what happened?
Yeah. Dr. Bill and Ann Jennings, they are dog lovers and they believe in pet therapy, and they made a very generous donation to our program. So I know that Dr. Bill is very familiar to the Grosse Pointe community, and he and his wife just felt that this was where they wanted to help out. So we're really grateful for that. And as equally exciting for us is Dr. Bill has decided to become a volunteer handler. So he'll be joining our team at St. John Hospital, and he will be, we always say, escorting Paxton and Hope around the hospital. And I'm sure he'll be seeing a lot of familiar faces because I know that they are very well known in the community. And it really gives him an opportunity to see firsthand how their gift is helping our patients.
And when the dogs smile, they'll have great teeth.
Oh, I love that. They will.
I happen to know Dr. Jennings and his lovely wife Ann, and they're wonderful, kind, great people. And I would have to say I didn't really know about that until we did this show, but it doesn't surprise me that they would do that. They're just great, great people, and I'm sure they're very excited to be a part of that. And and it brings something that we all, I think, come to realize. When we give, we get back so much more in return, and it really, is a great part of life, and engaging in the community and others around us who we may know or may never know. And it's a great way for us to be a part of that. So, Paxton and Hope have been very, very well behaved, and thanks to both of you. So I'd like to talk with both of you and just kind of, engage you in your experience with Hope and Paxton. So, and Kathy and Diann, either one of you feel free to speak up. How long have each of you been a volunteer, and what made you want to be a part of this?
I've been doing it for, it's going to be 7 years, and I started at the beginning with Hope. Mm-hmm. And I love dogs. I work with dogs already, so I'm around them all the time. I walk dogs and do a lot. And I just thought it would be a great way to give back. Mm-hmm. And then I've had some wonderful experiences that people thank me for the dogs, and I just feel bad because I feel like I'm getting so much more out of it. And the dogs were wonderful because I love dogs. But the things that they do, the stories that you told are true. I had a little boy, he wasn't little, he was 16, but had more of a mentality of like a 4-year-old. And he had to take meds on a regular basis, and his parents came and got me when I first started with Hope. And she went in that room and she sat next to him, and he was flailing, and as soon as she went in, he just relaxed, and we all were almost crying because that's what it's all about. It let him do what he needed to do, and the dog was just who she is, which is a wonderful dog. And Paxton's a new dog and he's learning, but obviously he's really good. Look at him.
I would say great.
So I'm very blessed with this and I love it. So that's nice.
I look at them, you can't help but want to reach out and pet them and be with them. And they have a great sort of calming effect. And how about you?
Well, I've been doing this for about 4.5 years now. I worked at St. John's for 30 years, and when I retired, I was a nurse. When I retired, I didn't have an animal at home anymore, and I missed having an animal. I saw that this program was going on, so I went to, they had a class at Macomb, and I went in there and I met Parker and I met Max, and I went, oh, I love this. This is for me. So then I made arrangements to meet Cindy at St. John's, Maine, and then I started out with Hope, and I went to the classes. It's been a wonderful experience, and it is. It's very rewarding. It's the best job I've ever had.
Isn't that great? So Diann and Kathy, what kind of training did both of you have to go through to be a part of this program?
Well, I work with dogs a lot. I used to work at a zoo, so I have a lot of animal experience, so that was a good thing. They were really good at showing us how to keep the dog, like they want to play, and they have to understand when they put their jacket on, we're going to work. And like when we see each other in the hallway, we kind of don't let them see each other a lot because they're like, hey, Hope, hey, Paxton. Yeah. And we don't really want that because they want to play because they're labs and they're dogs. Yeah. And so they just brought us, I went around actually with you, I think, I'm trying to remember, it's been a long time. And they showed me all the different places. The hospital is really big. And so it was a good experience and I learned a lot and it's been great ever since. I've been doing it ever since.
And so maybe you can speak for them. What's a typical day like for them? What are their hours that are working and what is the day like for them?
Well, they come in the morning, they drop them off, and I have a morning shift. That's my shift. And so you take them around. First I take her outside. That's our fun thing. We take a nice little walk because I feel it's really important that she clears her head before she goes to work. Mm-hmm. And I think she likes me a little bit better because I make that big effort. And then so we take her around and she visits. We have a certain route that we do so people at the hospital know her and love her. And they go, oh, it's Hope, we love Hope, and it's so wonderful. And they always do what you said. And Hope's handler, we love you too. And I always say, if you love Hope, we get it. I mean, you don't have to say anything to us.
It's like when a baby's in the room, everybody else goes away.
Yeah, and so then I bring her back.
Baby and the dog.
And then the next person picks her up for the afternoon shift. And I've only done the morning shift, so that's kind of my...
And I do the afternoon, and it's basically the same thing. I take her for a little walk before we start. And then we go to different departments. We have floors that we are assigned to, but then we are also allowed to go to any area in the hospital except for obviously like the NICU and the operating room and things like that. So we just make our rounds and people just light up when they see her. And I've even had a gentleman whose wife was blind and, down girl, she's getting a little excited, who was blind, terrified of dogs, and his wife wanted to have a seeing eye dog. So I approached him and said, can I at least introduce him to his wife, because his wife was excited about her being there. And he said yes, and he stood back, and he watched, and eventually when he saw how calm she was, and he came up to her, and then he started petting her, and he says, I think I can do this. I says, the dogs are trained especially to behave and to give you the support and the leadership that your wife is going to need, and you won't ever have to be afraid of that dog. And when I left that room, he was going, I think I can do this, and honey, I think we're going to have to go look into this. And it was just a perfect type of experience. It just happens like that all the time.
So, Diann and Kathy, what advice would you give to anybody who may be watching who says, you know what, I think I'd like to be a volunteer handler? Any thoughts you'd share?
As long as you enjoy dogs, it's a wonderful experience. Right. And even a couple of our handlers were cat people. They've never had a dog, but they ended up falling in love and able to do it, and they enjoyed it. It's just, it's almost therapeutic for yourself.
It is. Yeah. And they're so well trained, so you worry that they're really good, And the other thing is, it does bring so much to you. You can't tell people. I mean, I've been doing it for a long time. I didn't think I'd be doing it this long. And there are days I'm like, oh my gosh, I have to go. But when I get there, it all changes. And I'm very blessed. I think it's a commitment, though. I do hear people thinking that since it's a volunteer, they can kind of do it when they want. And it's a commitment. They need you there. The dog's there. People are waiting to see you. It's really a job, and it's a great job. But like anything, if you commit, it works great.
So, how, anybody who wants to answer, how is it decided? Is there a process like that's gone into, like, how is it decided what patient gets to see a dog or gets a visit?
Sometimes the family requests the dog to come in, but otherwise if you go, like we have certain floors that we go to and we just knock on doors, or we just open up the door and see if there's somebody, introduce ourselves and say, you know, this is Hope, would you like to see her? And some folks will say no, and other people, yes, they light right up. But and a lot of times it's just the visitors would like to see her. It calms them and it gives them a sense of,
Sure.
of hope almost.
The family and the visitors are going through what the patient is going through, and they need that too. They need that as well.
Employees also.
Oh, yeah.
Sometimes they're having a rough day. Can I come up and give Hope a hug? And they just get down and hug her, and they say, "Oh, I feel better," and they walk back off. And it's,
You both get lots of hugs during the day. Everybody loves to see you. So we're going to be winding down shortly, and I'd like to give you all an opportunity to say something before we close our show. Anything that you want somebody to know that you haven't said?
if you have the inkling or love dogs, or even don't even love dogs but would like to try, this is a wonderful experience, and it's well worth the time and the effort. It really is.
And I'm not even a hospital person. I'm just going to put it out there. I don't really like to be in hospitals, but obviously it's working out okay for me. And it's a gift that people, when they see you with her, it's like you're special. And I just feel so blessed that they share these intimate stories with me about their animals and their life. And I just almost feel like, my gosh, you know, I hardly know you, and that's such a sweet, kind thing to share. So I can only say wonderful things. I'm very blessed, and it's only brought me meeting good people, and I really enjoy it.
And we don't have much time. Cheryl, is there something you want to say? How, is there a contact number or contact person, or how would somebody get involved?
Sure. If you go to St. John Providence Health System and look on the web, .org, and you can look up the volunteer departments at the hospitals, and that's how we would get involved.
Great, great. Well, you've all been great guests, and you have Paxton and you have Hope. You've been the stars of the show, and thank you, Diann, and thank you, Kathy, and thank you, Cheryl. Really appreciate that you all came together and took time out of your day to do this. It's very special. And thank you to our viewers as well. As always, we appreciate the time that you take to watch our show In a Heartbeat. It's great that you came with us. Thanks for tuning in. Take good care of yourselves and those around you, and have a great day. And who knows, maybe you'll see Hope or Paxton next time you're at St. John.